Welcome back to the Poultry Doc Podcast. I'm your host, Dr. Blayne Mozisek. Today we're in Bryan, Texas, checking out 3 sick hens. During our exam, we'll show you how to check conditioning, how to tell if a hen started laying, and give you practical tips on submitting lab work without a vet nearby. Let's head out to the coop. Welcome back to the Poultry Doc Podcast. I'm your host, Dr. Blayne Mozisek. Today we're at Chris's house in Bryan, Texas.
Yep.
So a little ways from Austin, but we made the trip out here. Chris, what do you got going on? You want to share what you've got at the place and what you're seeing?
I've got a variety of chickens, I got quail, and then some annoying guineas out there. But the issue I'm having is I've got these hens that I got as adult hens already, and I've had a few of them. They kind of got a runny nose, and their eyes got a little puffy, and a few of them just kind of randomly died. I'd go out there in the morning and let everybody out, and there'd be a dead one. Okay. And so I've got 3 left, and I've got them pinned up separate so we can see maybe what's going on, and hopefully I don't get the rest of my flock sick.
Right. Now, how many did you start with?
10.
10, okay. And you said you started about a year and a half or so ago, and how did that start? You brought in chicks or you bought pullets?
I brought in chicks about a year and a half ago. I bought them from a lady on Facebook. We've actually become pretty good friends. I don't really enjoy the chick stage too much, which is why if I can get an adult hen, I will. But then there's that risk of introducing illness and stuff that I also don't like. So.
Right. Yeah, and we talk about that a lot where, Mycoplasma is the one that always comes up, but they can come with other issues too, bronchitis or Newcastle or other respiratory bugs. But yeah, we'll check it out today and see if we can figure out what's going on.
Awesome.
See that one in the corner there is probably the sickest of them.
I wish the ones that were the sickest hadn't died so you could see, because it was, that runny nose, were almost like it was sticky though, so things would kind of stick to it.
Yeah.
And the eyes, they didn't get swollen, like I've seen pictures online, but it just kind of watery and little bubbles in it a little bit.
Bubbles in the eye, a lot of times Mycoplasma, but it can be like LT for one, which you'll see them like gasping for air, because basically what happens is the virus doesn't kill them, they actually they asphyxiate because they can't breathe. And that one we can vaccinate for pretty easily. It's actually just an eye drop. And there's another one that's a wing web vaccination. It's actually a recombinant, so it's a pox virus that they put the proteins on it for LT, which is laryngotracheitis.
Okay.
So you get the protection for both from one vaccination.
And so those 3 they're high lines, and so they're, from what I know, they're not a real meaty bird.
Yeah.
But I don't know if you'll feel when you hold them how thin the breast feels.
Yeah.
And I don't know if that's normal for that breed or if
no.
They're just...
Yeah, so they lose, they start to lose condition when they're sick, right? They're not eating.
Right.
So one of the things you'll hear me talk about or ask on the forums is, what's the condition, the body condition? And we've spoken about it a little bit before on some of the videos, but what you want to feel is the breast, and it depends on how old it is, but a younger normal chicken would have more of a V shape. So with the tip of the V being the keel bone or the breastbone, and then the kind of tissue in between would be the breast muscle, right? And so in a younger bird, it's going to be more of a V shape. As they get older, it rounds, and obviously the more well they're fed, it can get fatter, right? So meat birds tend to be more like a U shape and grow wider. Laying hens don't typically have a lot of muscle to begin with, so they're more of that triangular shape. As they burn, if they're sick and they're burning through muscle, so basically breaking down muscle for energy, that muscle goes away and it's like an inverted sort of triangle, and that's what you feel on her. I know you guys can't feel it, but not a lot of muscle there at all. That's kind of one of these indicators of obviously she's sick. And it's also one, if you just saw her walking around, you would never be able to tell that she was as thin as she is. And we talk about weighing and how important that can be just as an early indicator of something that's going on. I know with a lot of birds, it's hard to do, obviously, but if you've got 5 or 6 or 10 chickens in the backyard and you handle them frequently, that's another good reason why weighing them can become important. And just feeling them, occasionally, you can obviously get an early indication of what's going on. So one of the things we worry about too is, Marek's is a immunosuppressive disease.
Okay.
So it just opens them up to any number of different things.
Right.
And it being cancer, essentially, just like in people, you sort of wither away, right? Your energy is going to feed the cancer. So while she doesn't have any sort of neurologic disease, it's one of the things that could potentially be on the list, and probably not vaccinated because they came from local breeder. But again, it's one that shows up that we would want to think about. I don't feel any. Sometimes they'll have tumors in their abdomen that you can feel. You can feel her gizzard really well, and that's about it. Again, she's pretty thin, so it's easy to feel around there. But based on what you described, we're thinking respiratory disease because she came in, started not feeling well, and had respiratory disease earlier. There she goes. Now she's making some noise. So she's got more muscle on her. It's still pretty thin. And one thing you can feel, so these are sick. They're not in production. Well, you said you pulled one egg out
I
of
did
here.
get one egg out of them this morning.
Okay. You know, this is one thing we haven't talked about before. Do you know how to tell if a bird's in production or not?
I don't.
Okay, so when you hold her, you can hold her breast, right? So I'm supporting her by her breast. Right behind her breastbone, if you go back, there's her, we call it pin bones.
Okay.
And so a bird that's in production, those pin bones need to be wide in order to make room for the egg to come through.
Okay.
So you can feel her. It's like you feel that breastbone underneath.
Okay.
And you run your hand back, and then past the breastbone, you'll feel two bones there.
Yep.
Okay.
Right there. Okay.
So how wide would you say those are? By finger width.
I mean, at most 2.
So she is not in production. So typically in a hen that's like really actively laying, you can almost get usually like 3 fingers just between those bones. Like I said, the wider they get, the more they're laying. She's an easy, like I can get 2 fingers between there. And so again, what I'm feeling is just run my hand down the abdomen and you'll feel 2 little points. It's the width between those 2 bones is a good measure of, you see there's my fingers. You can see the edges of the bones. I know with the feathers, you can see them now.
All right, come. Yeah, she is significantly heavier than that one. And
Yeah.
she's still not big.
No.
You know.
So, looking at their eyes, so her eyes are still bright. Obviously, when she was in the cage there, she's kind of hunched up, not feeling well. You can tell. You can definitely hear the respiratory noise here in the mic. Hear that? Okay. So, what I would suggest, they are molting for sure.
Yeah.
The things we want to look for mites, because sometimes we can get like depluming mites that come in here too and start to cause some of this. When did you say you got them?
These I got about 2 months ago.
Okay.
Month and a half, maybe somewhere in there.
So she's losing feathers. Where she's losing, you can also see these pin feathers coming in there. You see like there's one right there. So she's losing feathers and she's growing new feathers.
Okay.
Which is a good sign, but she's got some of this matting in here too. And it could be also she's just not feeling well. So she's not preening like she would, just doesn't feel very good. One of the things, I mean, this is one spot where you can find them like under the wings. It's not always, but sometimes. And a lot of times that skin will be flaky because they irritate the skin.
Right.
Some of them burrow into the skin and actually directly affect it. When you got them, were they pretty rough when you got them?
They were.
So she could be getting over some of that too. So with like northern fowl mites, you can find those. The base of these feathers, like around the vent, it's a good spot. There's moisture there and it's warm everywhere, but it's another good spot for it. You can feel them, to be honest. I always feel them before I see them. I don't see anything. See, I think she's just normally molting. But yeah, typically with molting, we'll see it start around the neck. And you can see she's got a bunch of pin feathers coming in there around the neck. So that's probably what it is. I mean, they all do it a little different. Some of them don't read the book exactly on how it should progress. But just definitely need to get her probably on some medicine. Okay. Because whatever it is, she needs to get over what she's on. We'll hope it's not a Marek's issue, and just if it is like generalized immune suppression, we can clear those bugs up with medication, like with an antibiotic. However, the Marek's is still there, and it could be something else would come up, and she'd be challenged by something else and just start it all over again. So, but in the meantime, these 3 especially, since they're dealing with it, do you isolate these?
I can put them over.
Put them over there and medicate them by themselves. So one thing with poultry, it's population medicine, right? So even though you're going to keep them separate, they're here, their feathers are on the ground. It could all be contaminated with it. So typically we would treat the whole flock. In this case, you kind of have them set off to the side over there. So it is reasonable to say, since these are the only sick ones and you've got the ability to do it, just keep them isolated for, say, like 2 weeks while you treat them for a week. Okay. And then give them a week to kind of get over it, see how they respond and start coming back. Okay. If you'd like, we can run a Mycoplasma test.
Sure.
So we've done tests for Mycoplasma in the past that are based on swabs and looking for DNA. So we take the swab, put it on a piece of filter paper, send that off, and we run a DNA test looking specifically for Mycoplasma, like the bug, the actual bacteria. In this case, there's also tests that can look for antibodies to Mycoplasma. So both individually Mycoplasma synoviae or MS, and then Mycoplasma gallisepticum, MG. And they're really simple tests. They're actually the first tests that were developed for these. There's a really simple one that's called just a plate agglutination test, where we take a drop of blood and we put antigen in it specific for the Mycoplasma. You just mix it up and it agglutinates. It's called the agglutination test. It's sensitive, but it's not very specific. So other things can make it go positive. If that test comes up positive, typically we then go to what's called an ELISA test, enzyme-linked immunosorbent assay. Fancy word. So it's definitely more specific and it's sensitive. Usually, in our case, we just jump straight to the ELISA test. It's a little bit more expensive, but not terrible. So again, what we're gonna do is just draw a little blood. We'll put it in a clotting tube, so a red top tube, and let that blood clot, and then they will send it off, the serum component of that, the actual fluid component, send it off, and they'll run the test looking for the antibodies to Mycoplasma.
She just said ow.
Mm-hmm. I don't typically need more. I don't definitely need that much blood, but I do need more than that. We'll get some more from your sisters. Stop messing with you. In this case, we're gonna pool them together. Since again, it's like flock population,
Yeah.
medicine doesn't matter.
Makes sense to me.
A lot of folks want to use these tiny, tiny little needles because they think, oh, they got tiny veins. It's actually easier with a bigger needle.
Yeah.
So I typically use like a 20 gauge needle. I actually did get a little smaller one because they were sick and I thought they may be dehydrated, so it is a 21. Okay. That's enough. Go back to the old tried and true 20 and it works.
Look at that. Oh, you're all right. That's good. I'll move from here.
Perfect, thank you. For the vets out there, I'm sure this is common knowledge, but we just want to make sure that these clot right, and in order for them to do that, they need to stay warm. It's cold outside today, so I'll just leave these in my pocket, keep them warm until they clot completely. Just take, I don't know, 15, 20 minutes, and then let them sit. Again, clot draws up and that serum comes out. It's convenient today because we're actually in college, or relatively close to College Station, so we can drop them off at TVMDL, which is Texas Veterinary Medical Diagnostic Lab here in town. So quick and easy, and if you've got access to any of the state labs, especially states that have poultry, they're very easy, very convenient, and often cheaper to run tests through those labs because the state labs, some of them subsidize the cost of the tests. So a good resource to have or to make use of if you've got it. We should have results from the test within a couple days, really.
Okay.
It's pretty quick, especially if we can drop them off today.
Awesome.
Today we were out at Chris's house in Bryan. Chris, first of all, thank you for
Absolutely.
letting us come out. We've looked at 3 of Chris's hens that have some respiratory disease, and we looked at a little bit of different way to test today for Mycoplasma, and that's with a blood test. So we're going to drop off those blood samples, or actually serum samples, at the Texas A&M lab, and we should have results probably tomorrow, if not the next day. So
Great.
By the end of the week, we will know something. And yeah, again, we really appreciate you coming out and
Absolutely.
sharing your place with us.
Absolutely. Thank y'all.
Yeah, well,
Thank y'all.
thanks everybody for joining. If you like what you see, please subscribe and like the channel. This is the Poultry Doc podcast. Thanks for joining.